Portion of Daytime Tri-Cities is sponsored by Douthat Insurance.
Well, Medicare open enrollment is well underway. Now is an important time for seniors to make their selection. In fact, time is running out. That window closes December 7th. This morning we have David and Margaret Douthat here with us from Douthat Insurance to pass along some important information. It is great to have you guys on the show.
It's good to be here.
Yes.
What have the last couple weeks been like for you guys?
Very steady, very busy, but feeling good.
Yeah.
Feeling very good.
Yeah. And of course, this is such an important time. As we were saying, we are kind of getting close to where that window will close.
Yeah. So the Medicare open enrollment actually will complete on December the 7th. And that means you have the whole day of the 7th. Sometimes people think that they can't use that day, but you can. And then the affordable care will actually close out on December the 15th for January 1 effective, but they still have one more month, January 15th, to complete things for the year. It, of course, wouldn't start till February. So you still have time, but it is time to start kind of, you know, if you're wanting to make a change or if you're wanting to understand or need to update anything, now's the time to go ahead and start making those appointments and calling in and doing those things. But yeah, it's a good season. It's a busy season. There are some changes.
Yeah, there's some big changes.
For Medicare, the Part D is kind of the most important thing for people to understand, and for many people it's a positive change for them. So they're going to have a $2,000 ceiling, or maybe sometimes people use the word cap, or maybe sometimes they use the word max out of pocket. So it's a little hard for people to understand, but the positive information is that a consumer cannot spend more than $2,000 of their own money on medications as long as they're running it through their insurance and things of that nature. And so that's big news. The donut hole is gone for next year.
And so, Margaret, I know for a lot of people that will be a big cost savings.
Huge, yes. Yes, it is still hard for people to kind of understand because they've been experiencing such high dollars for medications for several years, and in fact not even taking some medications because of that. So next year should give you some relief.
Yeah, I know that's heartbreaking to see.
Yes.
Yeah, it can be a big savings this next year.
Wonderful. And I know too, working with veterans, you guys obviously a history with military, wonderful opportunity to really help them make sure that they're getting that health care that they need.
There is, and I mean, you have all the same Medicare Advantage plans and stuff that anybody's can use, but if you have Champ VA or you're using the VA or some of those things, there's plans set aside special for people like that, and a lot of them give money back into their Social Security, so it's a big money savings also, and they get, you know, some added perks. But we do want to say Happy Veterans Day a few days late to all our fellow veterans.
Yeah, and I know that's very near and dear to your heart, is really making sure that those veterans are getting the benefits that they should.
Yeah, and there's just opportunities out there that, you know, I don't think most veterans even know that they have that option. It's not well publicized, so people don't know, and they're losing out on a lot of money and opportunities there.
And that's why it's so important to sit down with you guys and go through all of the different options. And you said at the same time, beware, because boy, those phone calls are just bombarding some seniors.
There are so many phone calls coming in, and mailers, things that are publicized on Facebook that people truly believe is Medicare making an attempt to help them, but it's not. And it really confuses people. And so we try to say, please just avoid, just understand the purpose or the intent of that, and guard your personal information well, you know, because they are willing to share very personal things like dates of birth, Social Security numbers, Medicare numbers, not understanding that they're not legitimately part of the government trying to help them.
And there's nothing, I think people have a misconception that if somebody's calling them, there's something out there that's available that they can't get from their agent, but there's not. Your local agent should be able to handle any plan that's in this region, so there's not anything special that they can give. So if you have questions, somebody calls and you think, hey, this sounds good, just turn around and call your agent. Don't give that person that information. That way you know who you're actually talking with.
Some important information. Thank you both so much for joining us. Now is the time. If you would like to sit down with David or Margaret, you can do that right there at Douthat Insurance, their office right there on South Wilcox Drive. You can check out their website as well for more information.